So head and neck cancer is still a significant burden to global health, and patients with head and neck cancers have 5-year survivors of less than 50%. Even though treatments have improved, we still don't have good biomarkers for therapy planning for this kind of patient cohort. So currently at the Department of Otorhinolaryngology and Head and Neck Surgery at the University Hospital in Munich, we are conducting LIONESS. That is a prospective cohort study based on liquid biopsy. The aims of the study are to use or to investigate whether cell-free circulating tumor DNA can act as a biomarker for surgical tumor clearance, and whether we are able to detect molecular level recurrence in this kind of patient cohort to obviously ultimately improve patient the prognosis and improve treatment options for these patients. So we have completed whole exome sequencing of primary tumors of 46 patients from the study. And based on the mutational profiles, we have used the radar assay to design personalized panels. So that is with kind of choosing a median of 48 tumor-specific variants based on the exome sequencing. We've designed these panels and then used them to detect ctDNA from plasma samples collected preoperatively and postoperatively and during follow-up. And we've also analyzed a few saliva samples from this patient cohort. And with this very highly sensitive and specific assay, we've been able to detect ctDNA in baseline samples of 87% of our patients, and including also some of the saliva samples, and including very early stage 1 vocal cord tumors, for example, which I find quite incredible because obviously with like very small tumor load, it is usually very difficult to detect ctDNA in the blood or in the saliva. And post-operatively, we have detected ctDNA in 11 out of 46 patients. And all patients with confirmed tumor recurrences to date, they were all ctDNA positive, with lead times up to 256 days prior to clinical confirmed recurrences. And we've been able to detect the variant allele frequency of the ctDNA as low as 0.0005%, which is pretty sensitive and quite incredible, I think. There aren't any suitable biomarkers in head and neck cancer, mainly because particularly P16 negative head and neck squamous cell carcinomas have often or mainly have P53, a TP53 mutation that is tumor suppressor mutation. So we have actually a loss. So it's quite difficult to detect like a loss of gene, so not an oncogene. And currently the pre-op kind of investigation is mainly the clinical examination, CT staging, so CT of head and CT of neck and chest, and ultrasound of the neck nodes. So that's kind of how the therapy planning is done, also in the follow-up. So we currently don't have any other biomarkers, which I think which why I think ctDNA is just such a huge opportunity, especially with this very highly specific and sensitive assay, to complement the current, so I don't think it's going to replace imaging and clinical examinations, but it's just going to be an amazing additional tool that is also independent of the clinical experience of the person who uses it. So a patient could just go to their local GP practice, get a blood sample done, and then the results sent to the hospital where clinicians then interpret them. And then, but for head and neck cancers, patients still would need to go to a tertiary center, a cancer center, to get examinations, because these kind of patients, especially the ones who smoke a lot, drink a lot, have a high chance of developing second primary tumors. Unfortunately, that's something that the personalized assay won't be able to detect, because obviously it's based on the mutational profile of the initial primary tumor. But because of field cancerization, these patients often develop second primary tumors. Hence, clinical examinations in hospital environment is still needed, but with a personalized ctDNA based assay, we'll have the opportunity to detect this disease or recurrences much earlier, and then obviously implement treatment much earlier, and ultimately improve prognosis, and maybe also prevent some of the very morbidity or treatment associated morbidity in this patient cohort.